Hi, I'm Jackie Andraka with The Scoop, and we're here with Professor Warren Wiechmann, who is the Associate Dean of Instructional Technology as well as Assistant Clinical Professor at UC Irvine. So tell us a bit about how you're using instructional technologies with medicine.
So for us, it's a really big deal, I think, to use new technologies and innovative technologies to engage our learners, students as learners and students as educators, and now trying to put these technologies with our students and our patients together to really get them to engage more together. Yeah.
So kind of like a student-teacher, student-patient dialogue.
Yes. And there's so many great tools that are out there right now with the technology that I think it's a ripe time to sort of take advantage of all these tools that are out there. Before, it was just really paper and pencil or diagramming, but now there's a lot more ways that you can really match the learning style of either the student or even the patient and interact in ways they couldn't interact before.
So how does this tie into participatory medicine and quantified self?
I think a lot of it is it creates a construct for our students to spend more time at the bedside. They've always had a reason to sort of be there with the patients and to engage, but now when you sort of give them a framework for your job is to educate and use this tool at the bedside to allow yourself to interact more, there's better ways that they can do that. And so for them, it gets them and the patient discussing. The patient gets a little bit more information out of it. The student gets more feedback as well. And it starts to get into that whole discussion of what do you do with quantified self? What do you do with all that data that the patient's collecting? Because a lot of times there's never time for that discussion in a clinical encounter. And so this is kind of putting someone there with the patient for the extra 10 or 15 minutes. And it opens up the door to all these possibilities, which is great.
And I saw that you're also using iPads and technologies like that. So what are you doing with those?
So for us, the iPads have sort of served as the core part of our curriculum. We've got a full digital curriculum now where all of our content's digital, from notes to textbooks to interactive apps that they use for learning and patient education. We also have been using the iPads just, again, to connect clinically, also taking advantage of some of the video messaging services where we can connect students to other students using the iPads, to iPhones, to other desktops using things like FaceTime or Skype within the hospital, and trying to find frameworks to do that in a more secure way between consultants and patients, etc.
So if you had a piece of advice for a fellow instructor of either residents or medical students or even undergraduate and high school students, what would you tell them about how to use this instructional technology?
The thing with the technology that I find is it's very easy just to find the newest toy or the newest device out there and try and incorporate that. But it's really important, I think, to talk to your sort of end user, whether it's the students, whether it's the patients, and really figure out how can you make this something of value and trying to figure out where the value is. And that's where you don't have those rates of people just dropping off and saying, well, I used it for a little bit and it went away. How do you actually create the value around it, and how do you support that?
And how are you using social media in this instructional technology to connect patients with students and practitioners?
Right, social media is another great example of things that have historically in medicine never really been talked about before. And our students, they're pretty good at being on social media as an individual, but as a lot of the speakers here have talked about, they're kind of terrible at it as a professional, as a physician. And so having the technology there with them is sort of a way to say, well, the technology's here, well, let's show you what the patients are doing with it, and now you really have no excuse to not get involved because you have all the tools there in front of you, but how do we actually teach you how to use this properly? And so for us, it's a really good opportunity, I think, to get these future physicians more equipped to handle kind of where our patients are today.
Thank you so much for taking the time to speak with us.
Awesome, thank you.
Thank you. For The Scoop, I'm Jack Andraka.